Sometimes we search out dizzying experiences like kids spinning in circles till they fall down or adults going for the thrills on a loop-to-loop roller coaster. But imagine if that case of the spins didn't go away. That's what vertigo feels like. Dr. Raj Bhardwaj is our medical contributor on Edmonton AM. He joins us now with more on that. Hello.
Good morning, Mark.
So what is vertigo exactly?
So first of all, vertigo is a symptom, not a diagnosis. So if a doctor says you have vertigo, that's not just what's going on, that's just describing what's going on. It's this feeling of apparent motion, right? And that feeling makes people dizzy. And boy, I could talk for 20 minutes on how dizzy is a difficult word for doctors because it means different things to different people, right? So some people mean lightheaded, almost fainting. Some, when they say dizzy, they're sort of just this kind of generalized weakness. Things like my grandfather used to say that he was feeling giddy, and giddiness is actually a synonym for vertigo. But by vertigo, we mean this feeling of apparent motion. So either you're moving, or you think you're moving, or you think that the environment is moving around you. And that's very particular symptom. It can be due to trouble anywhere from the brain, where the signals are dealt with, to out in the sensory equipment, which is usually our eyes and our ears.
Well, I've known people who've had it. I think my wife experienced it for a while, a good friend of mine. What can cause it? A wide variety of things?
Yeah, it is surprisingly common, and it's an inner ear problem usually, especially in young, healthy people. The problem for doctors and for the general public is that a lot of other conditions can cause this vertigo. So there are certain scary things like strokes and tumors that can cause it, but those types of things almost never cause just isolated vertigo. They'll give you vertigo and something else. So there are other things like viral illnesses of your ear. There's this thing called Meniere's disease. And of course, most people are aware that alcohol can cause vertigo, right?
I'd say, yes.
Yeah, so there's this thing called the bed spins, where you get home from the bar and you're lying in bed and it feels like you're spinning, right? But if we focus on common causes, the most common cause of vertigo is this thing called benign paroxysmal positional vertigo. So paroxysmal means it just starts all of a sudden, and benign, of course, means it's not going to kill you. And positional means that when you move your head, when you change positions, it actually hits you. So can I talk a little bit about how we deal with balance in our brains? So when we turn our heads, there are these little canals on the inside of your ear. If you think of them almost like a big hula hoop that is hollow on the inside, and it has fluid on the inside. And inside that hula hoop type thing, you've got these little hair cells, kind of like seaweed floating in water. So when you turn your head, the fluid in that hoop moves, and then the hair cells, the little seaweed, kind of moves as the fluid moves. Kind of like when a wave washes up on shore, the seaweed on shore kind of moves, or near the shore moves. So once those hair cells move, that sends a signal to our brains telling us that we're moving, or that the world is moving, like in a car or on a roller coaster. Sometimes there's a little tiny stone, like a grain of sand, that gets stuck into that seaweed, which then causes that little seaweed hair cell to send a signal to the brain that we're moving, even though we're not. And that signal coming from your ear saying, hey, we're moving, versus the signals coming from your eyes saying, we're not moving, that confuses your brain, and that gives you that vertigo, that vertiginous feeling.
So what should we do if we feel like we have vertigo?
Oh, well, the first thing is don't panic. It feels terrible, but it's not usually dangerous. If you're nauseated from it, then take some anti-nausea medications. If you are at risk for stroke, so if you're older, if you've got some other heart conditions, things like that, or if you have any other symptoms in addition to vertigo, so hearing loss, ringing in the ears, double vision, weakness on one side of your body, then that's a 911 call, because that's not just vertigo.
Yeah,
right?
That's more serious.
Yeah. So we worry about, like I said, things like tumors and strokes, but the vast majority of the time, this is a benign thing, especially in young people. Please don't try to drive yourself to the doctor's office if you have vertigo, because shoulder checking becomes awfully dangerous. And I've had people actually veer out of a lane because they're leaning against that feeling of apparent movement.
Ooh.
So get to the doc, get checked out, but don't necessarily take yourself. And if you've got anything else going on, then maybe bring the hospital to you. Call 911.
Now, is there anything doctors can do to treat it?
Well, the first thing is, remember, vertigo is a symptom. So the first thing we have to figure out is, well, why are you having vertigo? So a careful history helps us a lot. So think about things you've been doing in the past few days, or what were you doing exactly when it started? A lot of people, they'll say, I rolled over in bed and it's like somebody flicked a switch and I got dizzy. So the treatment options depend on what's causing the vertigo. So we should do a careful neurological exam, make sure that you're not having a stroke or that you don't have signs of a brain tumor or something like that. Usually with vertigo, isolated vertigo, you do not need a CAT scan or an MRI or anything like that. But there are these special head movements that we can do to actually figure out, is this an inner ear problem and is this a little stone problem? And if it is, then there are different head movements that we can put you through that will actually hopefully reposition the stone back out of the way, out of that sort of mass of hair cells or seaweed, so that they're not sending the inappropriate signal. And I've had times where I do this to people, and within 5 minutes they're walking out of the emergency room or the urgent care feeling way better. So it's pretty good. Now, we actually also enlist physiotherapists sometimes, occupational therapists sometimes, to help with people who get long-lasting vertigo. But most people, the vast majority of people, will recover completely from vertigo within a week or two.
Well, that's good news to hear. Thanks, Doctor.
My pleasure.
Dr. Raj Bhardwaj is our medical contributor on Edmonton AM.